Tonight, millions will struggle to breathe. For many in Calgary, standard treatments aren't enough. This isn't snoring. It's an airway collapse linked to heart disease, high blood pressure, and stroke. If you've tried a CPAP machine and found it uncomfortable or ineffective, you are far from alone. That's why some are choosing a permanent solution: surgery that physically rebuilds the airway. We'll break down how Calgary surgeons diagnose the issue, the procedures they use, and the outcomes. Obstructive sleep apnea is a physical problem. Tissues in the throat relax and collapse, blocking air from reaching the lungs. The signs are loud snoring, gasping for air, morning headaches, and severe daytime sleepiness. This is chronic exhaustion. If the issue is a physical blockage, why doesn't a CPAP machine always fix it? Let's look at the first line of defense. CPAP forces the airway open. Oral appliances reposition the jaw, but may not be enough for severe anatomical issues. Surgery becomes the primary option when two things happen: non-surgical treatments fail, and a clear anatomical cause is found. This brings us to the most powerful surgical solution: maxillomandibular advancement. It's a re-engineering of the facial skeleton. Surgeons separate the upper and lower jaws, moving them forward about 10 millimeters and pulling the soft throat tissues with them. The result is a dramatic, permanent enlargement of the entire airway, stopping it from collapsing during sleep. But not all blockages are in the jaw. Procedures like genioglossus advancement pull the tongue's base forward. Your oral surgeon will discuss which options are best in your specific circumstances. A consultation with an oral surgeon at one of Calgary Oral Surgery Group's 440 locations will allow a full assessment and time for answering your questions. With so many options, how do Calgary surgeons decide which is right? The answer depends on a pinpoint diagnosis. In Calgary, specialized clinics make these decisions. For instance, Calgary Oral and Maxillofacial Surgery offers major procedures like MMA. Unsure about whether or not you should be considering surgical treatment of your sleep apnea? Call or text one of our 4 locations and we can guide you. The goal across all our locations is the same: correct the anatomical cause of the airway blockage. The results can be profound. Successful surgery can drastically improve sleep quality and oxygenation. For many, this means reducing or eliminating CPAP use. Freedom from CPAP sounds ideal, but what does the journey through surgery and recovery actually involve? It's a process. Recovery time varies from a few days for minor work to several weeks for MMA. Post-operative discomfort is expected and managed. And like any operation, there are risks. These can include infection, bleeding, pain, or in rare cases, issues with speech. This is why Alberta Health Services is cautious, recommending surgery mainly when a significant anatomical issue is the clear cause. Finally, there is the cost. Fortunately, the investment is manageable for most Calgary families. We offer flexible payment options for all. So the choice of surgery isn't arbitrary. It requires a careful diagnosis to find the exact location of your collapse. Remember the airway collapse and the surgical tools like MMA? The goal is to match the precise surgical fix to the specific collapse. This reveals the fundamental difference. CPAP manages symptoms nightly. Surgery aims to be a one-time structural solution. Therefore, surgery isn't better. It's for a different problem. It's for the patient whose apnea is caused by a fixable anatomical flaw. Knowing the risks, costs, and potential benefits, is this path the right one? The decision hinges on one critical step. We've seen that surgical sleep apnea treatment in Calgary is a highly specialized field, reserved for specific cases where other methods failed. Ultimately, these procedures provide long-term relief by addressing the root cause of airway obstruction, offering a potential end to the struggle. While it's a major undertaking and not for everyone for the right patient, it can be a truly life-altering intervention. If you're in Calgary and your treatment isn't working, the next step is a consultation. Proper diagnosis is key to finding your solution.